you talk about healthcare in the street and in the community, it's very different.
I wanted change, and I was looking for places that can help me make that change.
We always try to help patients not just feel in control of their care, but actually be in control of their care.
No matter what you identify as, this is a safe space for you.
Callen-Lorde is a primary care community health center. So mostly what we do is medical care for people, primary care. We also have a dental department. We have a special department just for our adolescent patients called HOTT, Health Outreach to Teens.
Our main target population are LGBT identified young people, lesbian, gay, bisexual, transgender. And a big issue, especially for young LGBT identified people, is they may not be out to their parents, who are usually their primary connector to healthcare.
And we still have people come in that say, you know, I went to another doctor and, you know, I couldn't tell them I was gay. And whenever I did tell them I was gay, they told them, of course I have HIV. Like, there's still a lot of that out there. There are still people who recognize that being queer and being gay matters. That identity matters in the bigger picture of health.
I'm the HIV provider for our program, so any HOTT patient who has HIV, is infected with HIV, I'm their care provider. We do primary care. I provide care for transgender identified patients. So I think in the short term it sort of frees people up to have what I hope is both a safer life, but a more satisfying, less secretive life, and a life with greater self-acceptance.
We're doing a pretty extensive renovation because the building that we're in today was opened in 1998, but we're pretty much maxed at capacity. We're going to be seeing about 60,000 patient visits this year.
Just medicine in general is really intimidating in the body. Like, we live with it, but we don't know it.
We always try to help patients not just feel in control of their care, but actually be in control of their care. So we try to provide them with the maximum amount of information, the maximum amount of safety, the maximum amount of appropriateness on our part.
At the time I was going through a gender identity crisis. You know, I felt completely lost in my own skin. I was pretty much disgusted with myself. I was miserable until finally I said to my mom, you know, I want to see a doctor about this. I want to get better. I want to be myself. And I want you to help me. And she said, okay, and came down to the HOTT program. I started counseling, and then when I turned 18, I started hormones. And basically it was smooth sailing from there. There was really no pressure, you know. If you were ready to talk about something, then you could talk, and you wouldn't have to worry about being judged or having them talk behind your back because of the confidentiality. In a way, they became an extension of my family. I look out for them, they look out for me, and it means so much to me to have them as support. I think anyone out there that feels lost or needs support or just needs help or someone to talk to, they should be here. Never think that you are alone, because there's always somebody out there who's in the exact same shoes that you are in. There's always somebody out there who's willing to help. And it's important not to forget that.
As you see from the name, we're called Health Outreach to Teens, so we have a big mobile medical unit. It's a 35-foot van that's outfitted as a clinic on wheels. So we not only provide care on site, but we actually bring health care to people in need.
They weren't coming to us. It's educating the community. It's allowing young people to have access and make choices. Young people don't like going into places where they feel disrespected or just intimidated. So it's a way of just joining the bricks together. You have to respect communities that you're going to, which you're moving in. We can do primary or we can do on-demand services. You know, we get a lot of young people that want HIV testing. you know, why, and then there's a discussion, and we talk about safety. One of the things they do come is, you know, sometimes they don't come from healthcare, they just want to come and have something to eat, connect with us, see the face behind the mobile unit, and they interact with every one of us. We're committed, and we're committed to the community, and we're committed to healthcare.